Pressure ulcers, sometimes referred to as bed sores, are a painful and serious problem. They occur most commonly in older adults, with at least 1 in every 9 U.S. nursing home residents experiencing a pressure ulcer. The financial impact of treatment is high too, with cost estimates ranging from $21,000 to $152,000 per pressure ulcer. Pressure ulcers are also one of the many complex healthcare problems the Duke University School of Nursing is working to address. Dr. Tracey Yap researches care and prevention of pressure ulcers and also recently received a $3 million NIH NINR grant to fund her team's research.
So I'm Tracey Yap, and I'm an associate professor at the Duke University School of Nursing. I'm going into my 5th year here. I think the first part of the research that we do, my team and I do, is all about repositioning and mobility strategies that will prevent pressure ulcers from occurring, particularly in long-term care residents in nursing homes. They're a vulnerable population, and so we've focused our energies there.
Dr. Yap and her team study a variety of different aspects of pressure ulcer care, from risk to care delivery.
So our current clinical trial is actually going to focus on the practice of turning and repositioning everybody every 2 hours. This is something nursing has done since 1962 to prevent pressure ulcers. But we don't have great evidence to say this is in fact what we should be doing. And there's been some preliminary evidence out there now. A trial by DeFleur and Nancy Bergstrom both have looked at extending that repositioning time to every 3 or every 4 hours. And they haven't found any difference. So meaning, if you reposition every 2 hours, you get X number of pressure ulcers, but you can go all the way up to 4 hours and there's no difference. They still get the same amount of pressure ulcers, right? So then theoretically, we should be able to extend to every 4 hours, and that's in fact what we're going to try to do in this clinical trial, is take a look at whether we can. And it doesn't seem like much, but when you think about the quality of life for the resident, so your mom's in there and every 2 hours in the middle of the night she's being moved, if we could just extend that to every 4 hours and there's no more danger for her involved, 4 hours of sleep is a different quality of life than being woken every 2 hours. And it also has big financial impact on the system as well, right? Because you won't take as many staff. The staff can focus on other things. Their energy can be towards other things.
The study even uses high technology to confirm proper clinical care.
We are right now working on contactless monitoring of residents to see if in fact they are being repositioned at the time they are documented to be repositioned at. But the neat thing is there's no contact whatsoever. This is sort of a low-level radar, if you will, that will take a look at multiple people at one time and be able to monitor in fact what is happening.
Dr. Yap says pressure ulcers are not a glamorous segment of healthcare, but are a real and growing problem as our population ages.
There's nothing sexy about pressure ulcer prevention science, right? It's not the glamorous field to go into. You don't see people out there doing walks for pressure ulcer prevention like they do for breast cancer or heart disease. And oftentimes it's happening to elderly people. They're rather vulnerable, right? And so I feel like morally this is where I should be. There's no reason really. I mean, there's a few pressure ulcers that can be prevented, or that can't be prevented, but the majority can be prevented. And I mean, this is something we as nursing it's said to be caused by nurses because we don't reposition, but the truth is we don't really know. I mean, if you're doing a care practice from 1962, we have no idea.
Pressure ulcers are just one of the many complex healthcare problems researchers at the Duke University School of Nursing are working to solve.